Hello, Miss Mason. I am Ashley Mims and I am going to be your genetic counselor. I am here to kind of explain to you more about Marfan's disease and clear up any concerns or questions that you may have. To give you a brief description of what Marfan's disease is, it's actually an inherited genetic disorder, which means that it gets passed down throughout your family that affects the connective tissue. It's actually caused by a mutation in the gene fibrillin, which is also known as FBN1, which is a crucial part in the elastin or stretchiness of the connective tissue. Due to this mutation, it causes certain growths of your body to be abnormal or disproportionate, such as having extremely long fingers or disproportionately long arms and legs, as well as affecting your vision and even having crowded teeth. This disease does not necessarily affect just one location of your body. It actually affects all over your body, such as in your bones, your eyes, your lungs, your nervous system, your heart, and even your blood vessels. To show you more in depth about the pattern of inheritance that this disease has, since I shared with you earlier that it gets passed down throughout the family, I have created what is known as a Punnett square, which is located on the left side of the screen. Marfan's disease actually has an autosomal dominant pattern of inheritance, which means that it only takes one parent having this one dominant allele containing Marfan's disease in order for their children to have a chance to get it. After doing this Punnett square is seeing that if one parent has this one dominant allele and the other parent does not, there's still a 50% chance that their children may still have this disease. And this is actually located on the Punnett square that is highlighted in red because both of those squares contain capital M's, which is the dominant allele. On my right, I have what is known as a karyotype, which represents the chromosomes in a human body. But this specific karyotype is made for a person with Marfan's disease because if you can see that the 15th chromosome in this image is actually circled because the mutation that causes Marfan's disease happens on the 15th chromosome with the fibrillin gene. And so this is to kind of give you a better image of where this actually takes place. I know that you probably have many questions running through your mind about this disease and how this disease will affect your future, but I do want to let you know that I am here for you if you have any questions, and I'm sure that your family is there for you as well. And I just want you to understand that even with having this disease, you will still be able to have a long and happy life. I have taken time to create some questions that I know that you probably have. And the first one that I know you're probably wondering about is, will I be able to continue playing basketball? Unfortunately, you will not be able to continue playing basketball competitively. With this being such an intensive sport, it can cause stress on your heart as well as putting you in situations where you can harm other parts of your body, such as breaking bones or tearing ligaments or tendons, which is not something you want to do whenever you have this disease. However, there are other exercises that you can look into doing to maintain your health, such as going on walks or doing light jogging. Even leisurely swimming can also be acceptable, just nothing that raises your blood pressure or causes too much stress on your body. However, I don't want to say that you can never pick up a basketball again because I know that playing basketball is your passion and something that you love to do. But what I would recommend you to do is that you go and you get a basketball hoop if you already don't have one and set it up in your driveway and maybe throw a couple of hoops a week. But the main thing is you don't need to compete competitively or maybe with even with other people, just to ensure that you aren't raising the stress level of the game. The second question that I thought that you may have is, what can I do to resolve some of the side effects of having Marfan's disease? Well, Marfan's disease actually has no absolute cure, but I can certainly help you with dealing with those side effects. The first one is one that I mentioned in the earlier question, which is about physical activity. And it's just very crucial that you take back your intensiveness of exercise, especially with you being an athlete. But I mentioned that earlier, so we can kind of move on from that. But something that is very important as well is if you ever become self conscious with your self image, with having certain things like crowded teeth, or maybe your vision is blurred, it is important that you take a look at the medical treatments that you can do in order to help these side effects. Because for vision, I know that you can have glasses, or if you don't like glasses, you can also look into having contact lenses. And if you don't like having those crowded teeth, then you can look into having braces or any other treatment that your orthodontist may recommend. And it's also very important that if you have any uncomfortableness with your disease at all or any of the side effects, that you first come to your parent about it and tell them, or you can come to your doctors and tell your doctors about it because we are all here to support you. And there also may be a way that we can help you with treatments such as the ones that I mentioned earlier, or at least provide emotional support for you. The third question that I thought of is, will this affect my future whenever I want to have children? Yes, this will have an effect if whenever you want to have children, but only to a certain degree. Because Marfan's disease does not prevent you from having children, but there are some risks that are elevated and some extra precautions that must be taken place if you do decide to become pregnant. And you have to talk to your doctors about these risks and precautions before you become pregnant. So before you start thinking about it, you need to go and talk to your doctor because pregnancy is a stressful situation, especially whenever you go to give birth, and there's not one set procedure that is the least stressful way. It's more fitting of what's less stressful for you. And also there are some medications that you may be taking because of Marfan's disease that you cannot take on while being pregnant, such as certain enzyme inhibitors or receptor blockers. So please just go talk to your doctor before you decide to get pregnant. But I know that's in the future, but just to let you know. Even though Marfan's disease does not have a set cure, you are still going to be able to live a long and successful life. And this goes along with the prognosis and treatment of having Marfan's disease. Now, something that you are going to have to incorporate into your life now is more specialists or like specialist doctors. And so I would recommend getting a cardiologist in order to track your heart and make sure it stays healthy because in order for you to be healthy, your heart has to be healthy. And I would also look into going to an ophthalmologist if you ever have eyesight problems to get contact lenses or glasses, as well as an orthodontist if you ever want to get any teeth procedures done. And also, if your bone density ever decreases as you get older, you may want to visit an orthopedic surgeon to see if there's any surgeries that you may be able to have in order to solve these issues. Also, with having Marfan's disease, you may have to have physical therapy for any of the side effects that come along with it. I hope that this has cleared up any concerns or questions that you have had about Marfan's disease. If you have anything else you need, let me know. If you ever just need someone to talk to or have any questions about this disease further, please don't be afraid to contact me